Well, hey, thanks for letting me be here today. I know you've had a long week, probably a lot of great sessions where you learned about a lot of assisted living facility information, a lot of new up-and-coming AI initiatives. I know I was at the bar last night and had a conversation with one of the vendors about some of the things they're doing in the ALF space around AI. So I know it's been just a great opportunity for you to learn this week and really, network and collaborate and have great communication and a fun time with all other members of the association. I do have a couple members of our team at the agency with me today. Marianne Salerni out of our Delray Beach office. Raise your hand, Marianne. She's back there in the back. And Arlene Mayo Davis, who's our field office manager, she covers Delray in Miami. So they were able to sneak away and join me today. So I got a couple things I want to talk about. Before I get started, I want to give you a couple of statistics. So as of yesterday, we have over 2,973 ALFs in the state. Of those indicate that of those, about 793 claim to provide memory care services. And I want to specifically mention that because there's a lot of conversation right now about memory care. We've had some proposed language to do a memory care bill earlier this year, didn't pass. But we're still engaged in that conversation. Had a great conversation earlier today with your board, with Florida Senior Living to kind of talk about some ways we can improve that. So just wanted to give you that metric. So the largest concentration of ALFs is guess where? Miami, that's right. So there were 807 ALFs in Miami, followed by Delray at 582. And then in the Clearwater area, 536. And the rest of the areas sort of shake it out a little bit. But the largest concentration, obviously, is down here in South Florida. And do you know out of those over 2,000, almost 3,000 ALFs, there are 117,625 licensed beds in the state. And of those, they're mainly 6-bed facilities. So the largest really concentration we have is 6-bed facilities. So I wanted to make a point to kind of tell you, now ALFs is not the largest provider we regulate, but they're pretty up there. So we have our healthcare clinics, our healthcare clinic exemptions, and then assisted living facilities. But nobody really beats labs. We have the most labs in the state, probably. Actually, between us, Texas, California, we probably have like the third or fourth most number of clinical labs in our state. So I did want to kind of give you a little bit of statistics. So before I kind of get started, so as I talk today, a couple things I want to talk about is just reminders for compliance. Got a couple of things I want to talk about. Kind of goes hand in hand with ALF top deficiencies. Then I'm going to talk about, I got kind of a 5-year review of top most cited deficiencies, and I got a couple of 23, 24, and current 25 I'm going to cover. Legislative updates, so I got that at the front. We're going to go through a couple of legislative updates as it relates to assisted living facilities and talk about that. Data. We get asked a lot for data. Arlene and Marianne will tell you every time we pull data, we're always saying, hey, validate this data. Let's do a QA check of this data, make sure it's right. So I do have some data to share with you. And sometimes it's been very interesting as I've talked about data this year in various conferences to show people like the number of total investigations that we do compared to this specific provider type. So be interested to talk about that. And I can never go anywhere, right, and not talk about emergency preparedness and response in hurricane season. As you know, in this area alone, we have seen some pretty significant events as it relates to air conditioners going out, not functioning. So we've seen some pretty significant issues. So one thing I want to charge you with is this is your industry. It's not mine. I just regulate it. Sure, I don't run an ALF. I don't own an ALF, which regulate it. This is your industry. You need to make sure the people who got up and left today and don't hear this, you need to make sure to share the message that we are making sure and holding facilities accountable for maintaining maintenance with their AC systems. It is hot. It is hot. I'll tell you a story. It was in the news down here. Arlene and Marianne know all too well about it. I got a call on a Friday night. Late on a Friday night about an ALF, what ended up being a class 1, but ALF From what we found out, about 2 weeks, AHCA hadn't worked. Was that right, Arlene? About 2 weeks, AHCA didn't work. Nobody reported anything to us. The facility was trying to do some things, although we're not sure what they were doing. You would have expected them to follow their comprehensive emergency management plan, right? And enact their plan and take care of that, maybe reach out to us, let us know, reach out to the county. No, what brought people to that facility is an altercation between two residents. So this altercation happened, and who shows up? Local law enforcement, EMS shows up, and then they're like, oh my gosh, it's hot in here. And that's all started that trickle effect. They had issues with their AC, they weren't getting it fixed. Finally, Friday night, after I get a call, they're calling to try to get it fixed. Our team spent all weekend, Saturday into Sunday, we're at this assisted living facility, micromanaging them to get them to relocate their residents. I think even at one point I reached out to Gail and said, hey, is this your member? Can you help? I always do that, right, Gail? Is this your member? Can you help? So, yeah, most of the time she'll say, no, it's not ours, but what you need. So, and I appreciate that because Gail's always stands up and say, it's not ours, but we'll stand up and help. So I started reaching out to other ALF associations and actually nursing home associations. And so eventually we were able to relocate all those residents. We did an emergency suspension order. They are still, the county emergency manager, the fire marshal did a cease and desist and close the facility. So I say all that to say, it's hot. People need to do a better job taking care of their residents, which means maintaining your maintenance equipment. Maintain that. Check your AC units. I mean, I have at least twice a year a service plan where they come out and check my units. A lot of times what we see is like that I'm holding it together with duct tape and clips, or paper clips. So a lot of that is what we see, but it is hot. People need to be more aggressive and assertive and make sure they're maintaining their systems because we are going to take very strong action and we have the authority to do it when this happens because residents have a right to be in a safe, comfortable, home-like environment. And temperatures cannot be above 81 degrees. So if we're getting reports of 85, 89, that's too hot. That's too hot. We know people die because of that. So emergency preparedness, always on our forefront of our mind, but even more this year, we've got to pay attention to AC units. So let's talk about legislation. So before I get into that, we all know there was a bill that was proposed. Actually, it kind of hit early at the end of last year, which was like November. And it was about electronic monitoring. Everybody remember that bill? Electronic monitoring. We all were like, what's this? I say that every time a bill hits, right? Don't I, Jim Brown? I don't care what it is. Get rid of that. So I don't want anything else to regulate, but we always getting something. But what I want to share with you is, and this has come up, we've had a couple of conversations about that, because when this bill hit, we were like, well, why? Well, this seems like a duplication, right? And a little bit of overreach too, I'll say. But I want to tell you that statute and rule right now does not contain language allowing or prohibiting the use of electronic monitoring devices in ALFs. And I do know there are some ALFs that do have electronic monitoring devices. There's some nursing homes that do as well. But I want to caution people to let you know, while it is your discretion to use electronic devices in your facility, to allow a resident to use that or a family member to do that, you have to ensure resident rights are protected and privacy rights are protected, okay? There's no prohibition against it, and that's one of the things that Jim shared with the authors of this bill is that this can be done right now, but we have to ensure protection of resident rights and privacy. And again, we do see that in our ALFs. We do see that in nursing homes. I see it in our ICF IDs or immediate care facilities. So nothing prohibits you, but I do caution you to ensure patient rights are protected. Okay? Just wanted to kind of make sure to share that because that's kind of come up a little bit. So wanted to share that as we start this legislation. Okay, then that bill didn't pass. There was a lot more required for that bill. But when it did come up, I remember us talking about it internally. And it's like, well, Well, wonder why this came forward, because you can do this, again, ensuring that protection of that rights and that privacy for those residents. So just wanted to kind of share that and get that out there for everybody. The next bill, this bill did pass. This is the only bill that passed that impacts assisted living facilities. House Bill 1421, the Emily Atkins Family Protection Act. And it created, in Chapter 429, which is your ALF statute, this consumer information. So there was an update. Obviously, the legislature found that pulmonary embolisms are preventable, and we know that they are preventable. That information about the prevalence of this disease could save lives. Getting that education out could save lives. The term pulmonary embolism means a condition in which part of the clot breaks off and travels to the lungs, possibly causing death. We hear a lot about this. Again, it's a preventable disease. A preventable incident. So the term venous thromboembolism means deep vein thrombosis. Everybody, any of you clinical, you know what I'm talking about. Blood clot located deep in that vein, usually in the leg or arm. It's usually more in the leg, from what I understand from research. And the term can be referred to deep vein thrombosis. And so that's the term probably everybody knows most about. Our pulmonary embolism in both. So now you're like, well, what does this mean for us as assisted living facilities? So this is the language that you see right here in my listen, I'm just going on talking and forgot to flip it forward. So y'all thought I just had all that memorized, didn't you? So if you look at parens D, this is exactly, this isn't Kim Smoak's language. This isn't Agency for Healthcare Administration's language. This is directly out of the new bill that passed and the new language in 429. It says here in parens D, assisted living facilities must provide a consumer information pamphlet to residents upon admission. Okay? Upon admission. The pamphlet must contain information about venous thromboembolism, including risk factors and how residents can recognize the signs and symptoms of venous thromboembolism. Say that fast like 5 times. So that is what you as an assisted living facility are required to do. This is what you're required to do. This doesn't require the agency to do anything, doesn't require us to do a pamphlet, or us to provide you with information to do a pamphlet. It says the assisted living facility must provide. Now make sure that you read all the new language in this statute that pertains to assisted living facilities, and make sure that you read what you're required to do. Now I know everybody's like, oh my gosh, surveyors are going to be out Monday looking at this. I can assure you we're not going to be out Monday looking at this. One of the things I did share with the association that I spoke with on Tuesday, and I have another ALF association I'm speaking with next week, and I'm doing this for consistency, is that once we get our regulation set update and sent out and provide education to our teams, we'll make sure to share that information with your association so they can get it out to you. But don't wait for the surveyors to show up and think, well, I'm going to see if they figure this out. Don't do that, because this is a very important bill, very important legislation, and we really at our agency are very supportive of this. That's why I've been the one talking about this. Jim Brown, who I think y'all have met, our legislative affairs director. Jim, you been getting out networking? Everybody know who you are? I'm outing you a little bit. Okay. I can put him in my pocket too. Y'all know that? Anyway, he wants me to. But he's asked me this, and I said, I think it's very important. I want to make sure I share this with everybody. I think it's that important that we share this message and we're consistent. So what we want to make sure to do is that as soon as we get this updated, we will get it out to everybody. But I wanted to share with you what that is. I also wanted to share with you some additional resources. So last year, there was created a blood clot and pulmonary embolism policy group committee that created this report, and this report was finalized in 2024, actually December 2024. Our agency, so my staff, were responsible for, we were the lead in the committee, and there were various, experts that were a part of our committee. We had agency staff, Department of Health folks, as well as industry experts. And so in this report, this final report, again, that is posted on our website, I'm going to show you the link in just a minute, but this report has some great information in it regarding promoting development of risk surveillance system and policy recommendation to improve the standards of care, just surveillance in general, detection, treatment, and then patient and family education related to blood clots and pulmonary embolism. So I wanted to share this with you to let you know this report is publicly available on our website. It's a 34, 35 page report, but really contains a lot of great information. Not saying that you have to use this, but it's kind of like, we spent a lot of time working with this great committee to put this together. So I really wanted to show you the work that we've already done to help provide you information that could assist you in developing your pamphlet to provide to residents upon admission. So just wanted to kind of share that with you. So that is really the only thing that impacts, from our perspective, from a regulatory perspective, that impacts assisted living facilities this year. Just to let you know, there are 4 provider types that were impacted by this bill: nursing homes, assisted living facilities, in addition to hospitals and ambulatory surgery centers. Hospitals and ambulatory surgery centers, they have a little bit of more work to do. There are reporting requirements they have to do to Department of Health. Department of Health had to create a registry to capture all this information, and then we'll be working with Department of Health at the end of the year, beginning of next year, to actually create a report about what has been reported by hospitals and ambulatory surgery centers. So just wanted to share that tidbit of information with you, is that hospitals and ambulatory surgery centers, their requirements are a little bit more expansive. So that is the only bill that we will be enforcing for assisted living facilities this year. There have been times where we have had a lot, but this is really the only one this year. So I want to get into talk about deficiencies. Everybody wants to know what we're seeing, what we're finding around the state as it relates to our deficiencies. And one of the things I did, now I did it, I took some time in working on this presentation to cover this year with assisted living facilities to look at some of what we're seeing in assisted living facilities. So what we did is I did like a 5-year review. So for the last 5 years, these are the top most cited deficiencies in the state. The top most cited. Y'all all taking my picture? Okay, thank you. I was wondering about that. I just want to be sure. I want to do a good pose. And nobody better get me with my mouth open either. That's kind of the going thing, I think, people do that. But as you look at the top most cited deficiencies for the last 5 years, now I want you to think about this, even you can pull your phones back out when we go to 23, 24 to 25. But when you look at these tags, staffing standards, in-service, resident records, these have always kind of been around, right? So I want you to keep all this in mind as we go through the next couple of years. Resident rights, rights and facility procedures. Remember how I mentioned about electronic monitoring and talked about, patient rights, resident rights. So this is where we would see that, so make sure you're familiar with that. Resident care supervision, that A025, that's been one of those tags that we cite elopement. We've seen some egregious events, as you know, related to resident elopement. So this is where we would cite that. Assistance with self-administration of medication and med management. We've seen this kind of in our top 10 over the years. Background screening. Now, I don't know why we keep talking about background screening. Do y'all? Sure not. But I will say we've gotten better with background screening in assisted living facilities. That's not one of our top most cited tags anymore, but it still creeps in there for us every now and then. Physical plant, and I got some examples for physical plant I'm going to talk about with you. Medication records, so documentation. It's one thing that with ALS sometimes we see not really good documentation, so make sure that you have thorough documentation. If you use electronic health records, okay, some of our bigger ones probably use electronic health records. And then lastly out for the last 5 years, again, training and assistance with medication with self-administration of meds. So this is our top 10 for the last 5 years. So let's look as we go to 2023. So in 2023, what do we see? Kind of some of the same things, those top tags, right? Staffing, in-services, all relates kind of to staffing, right? Staffing standards, in-services, resident records, resident care, facility practice. Remember A030 and 25, flip-flop there a little bit. They're kind of at the top. Again, that assistance with self-administration, records, physical plant, again, that's still in there, resident care elopement, and then training. Now, we don't see background screening for 23, right? So that's been moved. But this is our top tags for 2023. As we go to 24, again, don't y'all see the top ones still? Yes. Top one, we still see the top ones for staffing standards and staffing and in-service for your staff. So I got a couple things we're going to talk about in a few minutes with these. Again, self-administration of medication, resident records, physical plant. Now, physical plants kind of was at the bottom from the bottom 10. Now they're kind of, it's crept up a little bit here. Resident care, supervision, elopements, emergency management. So they're in 24. Had a lot of emergency management tags. And you know, one of the things too, from an emergency management standpoint, in 2023 is when we finalized the assisted living facility updated comprehensive emergency management planning criteria. Everybody remember that? So what I'm thinking is that we got that new one out there, and maybe some people, you know, didn't get their plans in, or they had some issues with their plans. But in 2023, that happened, and then we see emergency management criteria popping back into our top 10 in 24. Also, we saw background screening come in. You know, we really take that very seriously, so it's definitely something we look at on every survey we do. And then resident care rights and facility procedures at A030, you see that. So that's all the calendar year 23, all of 25. Remember, everybody's got that snapshot over the last 5 years. So this is the first 6 months of 2025. So everybody take a picture of that. Because we might be seeing what this is probably going to be what we see at the end of the year. So as you'll see here, kind of the same thing, what staffing standards is still there, but resident records have popped in to number 2. Physical plant. Now physical plant's really dropped up, right? So physical plant has really crept up into our top 10. Staffing in service, so we're seeing a lot with staffing in service again. That's still there. Assistance with self-administration of med management, supervision, facility rights, records, a couple of facility records, and also that resident care elopement. So I will say, we will probably most likely see, there might be a little bit of shifting for 2025, but this is the first 6 months of the year. And so we probably will see this as we go through the end of the year. This is probably going to be our top 10 that you'll see, but maybe rearranged a little bit. So, you know what? I mean, everybody always wants to talk about kind of our top 10. And so I wanted to kind of share with you a little bit of historical data. Wasn't that a little bit interesting, right? When I was looking at this, I thought, wow, we really do cite these particular tags a lot, like staffing standards and training in service. Obviously, that's at the top for the last 5 years and still in our top 5 for the last several years. So one of the things that we hope facilities do with this information that we share is use it. Use it from a quality assurance perspective standpoint, or quality assurance assessment and performance. I know you're not required to have a plan like that, but take this information if you guys are a corporate, you know, and you're looking throughout the state of Florida in your various locations around the state, look at that. You know, this is definitely something that's an issue that we're seeing in Florida with these top 10s. Look at this and see how you can go through your systems to make sure you're in compliance with these requirements. So one of the things that I've done is taken that, well, actually I stole it from somebody else who did a presentation earlier. Don't tell anybody. But we took the first five top deficiencies, and just want to share with you a little bit of information about it. So staffing standards, again, we know we saw that one. It's pretty high over the past, obviously 5 years into now. So staff must be qualified to perform their assigned duties. That's pretty basic, right? Consistent with their level of education, training, education, preparation. So a couple of things that our surveyors are seeing with this, the reasons why we're citing this deficiency right here: no documentation on record. Our staff are left solely in charge of the facility. So what that means is we come on site to do a survey. The staff member who's there, we have no documentation of any training or in-service records, nothing that this says this person is qualified to be there to provide services. So this happens a lot. I think we probably see this more in our smaller facilities, but this is one of our topmost cited tags. Also, staff who are trained to do CPR do not do so in an emergency. You know that we have had class 1 issues related to failure to initiate CPR in our assisted living facilities. And when we're doing the investigation, when we find out that staff who are on site are trained, sometimes they aren't trained, but those who are trained say, well, I didn't start CPR because I'm supposed to call the ALF administrator first. So we have had those, haven't we, Arlene? We've had those in in the Orleans area down here. That does happen. Additionally, obviously, communication disease statement, that one is required once within that 30-day period of time after hire and must be documented by a healthcare provider. This is something we see. Evidence of negative TB examination must be documented on an annual basis. So these are still some things that we continue to see. Additionally, background screening, obviously a concern that must be conducted. That level 2 must be conducted, including staff contracted by the facility to provide services to the residents. And obviously, staff must be qualified and trained to do their jobs. So that's that staffing standards, kind of what that requirement is, and some examples of what we're seeing out there. As we get to number 2, resident records. Requires each resident to have a record, including contracts, health assessment, and we ask you for these things when we come on site. Medical orders, got to make sure you have medical orders. And demographic information obviously has to be maintained on premises. And this is something, the weights issue and the hospice, this has been something that I think for the last several years ago, this was added, must maintain that weight record every 6 months of residents who receive assistance with ADLs, and obviously folks that are receiving hospice services can be exempt from weights, but their requests must be in writing. So we'll tell you about records being on facility premises. That is true, and what is true is that we have had examples where our survey teams have showed up to do surveys, and we have found out that, well, records aren't there because the owner, who has several facilities, probably has them in their car. And that has actually happened. And so that is not in accordance with the law. And they've been cited, and they've argued with us about it. And it's like the law is very clear that these records have to be maintained on the premises. If not, how are staff providing care and services, right? So they have to be maintained on the premises. So physical plant, number 3, under A152, this physical plant, provide a safe, clean living area, maintain free from hazards, ensure existing systems are maintained in good working order, making sure appropriate linens and clean linens are available. And so the next slide, I'm going to show you a couple of examples that our teams have cited. Probably no surprise, except, especially what I've just talked about earlier, that you'll see here, AC units with no frame around the outside, and so if there's no frame around the outside, insects are going to get inside, right? AC units installed with open exposed wiring, gaps around door frames, allowing insects. And we've had a pretty interesting case of insect rodent infestation in this area earlier this year. AC units not even functioning, clogged showers and drains, smells in the facility, laundry not working, insects dead and alive out there, emergency doors with no latching device, outside rain gutters trapped, resident rooms with no lights to secure their doors. I know a lot of you are like, oh my gosh, this doesn't apply to me, but you know what? You know what you can do? Get back to your buildings next week. Take a walk around your buildings. You know, whether it's you or somebody else, maybe somebody that's not used to doing that, what do they say? You know, we want to make sure that our residents are living in a clean, safe, comfortable, that home-like environment. That's why the whole crux of an assisted living facility is being that home-like environment. So take a look at that. Again, do tours around your facility, whether it's you or somebody else, have them go around. Number 4 that we see, the training under 81, training and staff in services. Got to make sure your staff are adequately trained. And we see these tags, this training staff tag cited in small facilities and large facilities. Nobody's exempt from this. We see this a lot. Related training and incidents, infection control, resident rights, and that's so important. You know, that's just so important, making sure staff are aware of what those resident rights are. Elopement procedures, you know, your staff need to know what your elopement policies and procedures are, so they need to know that and be able to make sure they're trained. And ADL care, want to make sure that our residents receive the appropriate assisted activities of daily living training. So as you'll see here, in-service training, new staff, you know, what new staff are required to have, at least that 2 hours of pre-in-service orientation prior to interacting with residents. So we want to make sure that they get that pre-orientation. That 1 hour in-service of training on infection control, including universal precautions and facility sanitation procedures before providing that direct care. As a matter of fact, I was speaking to a vendor earlier. I don't know if she's in here. We were talking about infection control. So so this is one of the main areas that you as assisted living facilities have to make sure your staff are trained on. And policies. Facility must use its own policies in the training so that the staff know what your policies are in your assisted living facility. Additionally, elopement training, we know how important that is. We continue to see very egregious events related to elopements, and that training has to be done within that 30 days. Review facility policies specific and provide a copy to the employee, so make sure the employee has that elopement policy. And demonstration and understanding and competency. It's so important that we make sure we provide staff with the skills necessary and the training necessary to do their job effectively and competently so that we can ensure protection of our residents in our assisted living facilities. And rounding out our top 5, and like I said, you know, we had kind of so much to sort of talk about today. Wanted to kind of hit sort of the top 5. And so here you'll see kind of the top 5 that you'll see. Rounding it out is assistance with self-administration of medication. You know, one of the things we do when our surveyors come on site, we're going to observe MedPass at each licensure or relicensure survey or on a complaint. So if we have a complaint investigation that we're doing and there's allegations of medication issues, whether it's assistance with self-administration or maybe expired meds or an issue surrounding meds, we're going to do a medication pass observation. And as you know, the statute rule is very clear. Only licensed staff can administer meds. Unlicensed staff, and we put med techs in there because that's the terminology you guys use. That's the term in the ALF world. Must follow assistance with self-administration of medication guidelines. And again, it's one of our topmost cited tags and has been for many years. And you know, all revolves around training, right? So if you look at a lot of themes in our top 5, they really revolve a lot around training and making sure that your staff get the required training, whether it's that 30 days within being newly hired or whether it's that ongoing training and education. So again, just wanted to kind of share with you, and I hope you take, you know, our hope is when we're sharing this type of information that you take this back, and I know a lot of you took pictures, but I'm sure Gail will make sure you get a copy of this so that you can share this with your teams and kind of talk through it to make sure that you're in compliance with these requirements. Next thing I want to talk about is emergency preparedness. Y'all know we got to talk about it, right? Everywhere I go, throughout, and Jim hears me talk about it. I think Jim hears me talk about it in meetings as well. always talking about emergency preparedness and response. And I'll tell you, I'm very, very proud of our state. I am when I go around nationally and speak, and actually I have a national speaking engagement in August to talk about Florida. And we really do a good job. Now, do we have some blips along the way? Right, we do. No, who's perfect? Anybody perfect in here? No, anybody raise your hand if you're perfect. Look at raising their hand in the back. Nobody's perfect, right? So we do have a little blips along the way. We have some folks that kind of sometimes can't get it together. But that's why we provide this education and talk through it to kind of help get people on track. But we really do a good job when it comes to emergency preparedness and response. We do a lot of things other states don't do. I know that because I talk to other states. There's a state director in every state, so we have an opportunity to talk. One of the things we always do is, one, we talk about it throughout the whole year because I know we're in hurricane season, but an emergency or disaster can happen at any time. Who would have ever thought we'd have had to close our offices in North Florida because of a snowstorm? Who would ever thought that? So we closed our offices in South Florida, but just operation as normal, right, guys? You're just normally working. Anybody from Tallahassee in here with us? Yeah, you know. So, yeah, we got hit by that storm. And I never would have thought in my whole career I would have had a hospital to call me and say, hey, Kim, out of all the things I'm asked for during a storm or any disaster, do you know where we can get some salt? And at first I know this person, I thought, was she having a margarita party? And she said, we need to put some salt on the emergency room entrance so that, on the ground so people couldn't, wouldn't slide. And I was like, you know what? And I grew up in South Carolina. We had snow too. And it's like, wow, I didn't even think about that, but that's true. But, we have to be prepared all the time, right? So one of the things to help keep you prepared is making sure that you're reviewing your contracts. Are they still viable? Make sure your arrangement for services are still viable, your evacuation plans. We know last year, anybody know how many hurricanes we had last year? Too many, right? One is too many. We had 3. We had Hurricane Debbie, Hurricane Helene, and Hurricane Milton. So we know Helene and Milton were very devastating for us, but we soldiered up there and we pulled ourselves up and we keep going, and we did. But there was a lot of issues with evacuation plans and transportation. Were any of you hit with, you were in evacuation zone D and then they changed your evacuation zone and nobody told you about it? Yeah, so we had several of our facilities that had that happen to them. And we had areas in the state that flooded that had never flooded before. I remember talking to an ALF, and she was like, well, we've never flooded. I know they told us to evacuate. And I said, yes, that's why I'm calling you. I just don't randomly call people and say, hey, you evacuating? No, I got called because this ALF refused to evacuate. And when I called them, the person said, well, we're waiting on the owner, but the owner is just insisting on us staying in place because we have never flooded, and I know that they said we're in a mandatory evacuation zone. That just changed. And I said, well, you have to evacuate. And she said, well, let me talk to the owner. And I said, well, let me share this bit of information with you. If you do not evacuate, I'm going to call the local law enforcement, and they will be coming by your assisted living facility. And this person said, you'll do that? I said, 100% I'll do it. Now, I didn't have to do it, but I would do it because our job is to make sure those residents are protected. It's your job, but if you're not going to do it, we're sure enough going to make sure that those residents are protected. Within 30 minutes, they called me back and said they was evacuating. But they were concerned about where they're going to go. And I'm like, that's why you have a plan. Verify your plan. Make sure your plan is viable. Just like this ALF that had this air conditioning incident that happened earlier within the last 2 months. It wasn't hurricane season in May or April or May, but you have got to make sure you have your plan. And this person, when Arlene staff showed up, he said, I don't know where my plan is. I don't know what it is. You should know if you're an owner, operator, an administrator, executive director, you're a leader in that assisted living facility, you should know what your emergency management plan is. If you don't know it, you got a lot of problems if your staff don't know it. If you don't know it and your staff don't know it, you got a lot of problems. So make sure it's viable. You know, if you had to evacuate, excuse me, if you had to evacuate and there were some things that kind of didn't work, update your plan, change your plan. I mean, you can modify. That's why you have exercises to modify your plan. Again, confirm those evacuation locations are still viable. We know that there's been a lot of change of ownership in the healthcare industry in general, whether it's ALFs, whether it's any other provider type. We've seen a lot of changes of ownership. And sometimes what we have seen is that those facilities are not verifying those evacuation plans are still viable. So maybe under a different ownership, so that ALF where you used to go may be owned by somebody else, and they may say, no, you're not one of our sister properties anymore. You can't come here. And you're finding out a few hours before you're loading the bus and taking everybody there. So make sure now your plans are all lined up, that you have things secure. You know where you're going, and you know how you're going to get there. I know that a lot of people think, oh, well, if I don't have transportation, the state will swoop in and save us. So let me tell you about the state. We're busy. There's a lot going on at the State Emergency Operations Center. Our Florida Department of Emergency Management, they do a fabulous job. I mean, obviously, we do really a great job. I mean, Kevin Guthrie is known nationally for what he does in Florida and protecting us during the time of a disaster and emergency. But he can't send transportation buses to every facility that's in an impacted area and evacuate people out, because while we're responsible for the oversight of healthcare facilities, he's responsible for everybody else in that area. So he's worried about those individuals who maybe are at home that don't have transportation, that they need to get them out. You know, he's worried about vans and buses, roads staying clear to get people out. So make sure it's your duty. When you apply to get a license from us, you are saying to the agency, I know what the regulations are. I am going to be prepared. I am going to protect my residents. And if you don't want to do that, if you don't have plans secured or transportations secured, then let us know. But you have got to get these plans in place. And know your zones. I know we just talked about that zones, A, B, C, D. You know your zone, which zone you're in. Again, there was a lot of changing in zones. Know your flood zone too. Know your flood zone. I live in Tallahassee, and I live in an area, I'm not surrounded by bodies of water, but I'm in a flood zone. I have to pay flood insurance. But so know your zone. And I may think, I'll never flood, but I have flood insurance. I'm required to have that. So check, are you in a flood zone? Be prepared. You may have not been in a flood zone last year. You might be in one this year. Also, make sure your staff know your facility plan. I am our agency's emergency operation coordinator. Whenever there's a disaster called, state EOC sends out a message. When something happens, I send out alerts to our management team. I send out alerts. I have a conversation with our teams about what's happening, what's going on. So your staff need to know what your plan is. They should know who to call. Because you know what? We're on site doing surveys, and we're going to be asking this question. So they need to know who's in charge, who to call. They need to know that. So just want to share that with you, some of the things we've seen about being prepared. Our health facility reporting system. I know we've had a lot of great updates to this system over the years. One of the next things that's coming is probably later this year is texting through our system. So you are required, as you know, you can't get past this screen. You have to put your contact information in there. So go in, make sure your contacts are still current. I know as we change administrators or maintenance directors or owners, there's changes. So make sure your contact information is current. You have to provide us your cell phone number. So with that cell phone number, if you're in an area in which we told you have to update every day by 10 a.m. and as your status changes and you don't update HFRS, so instead of us making all these multiple phone calls, we're actually going to send you a text message. And as soon as that text message is enabled and gets out there, then we'll make sure to notify Gail and her team to notify you guys so you're aware that that's enabled now. But those are some of the ways that we're changing and working on some of our contact with you. Make sure your utility information is accurate. And we need that information because the power companies, they know what the generator requirements are for nursing homes and assisted living facilities. They sit very closely to me when I'm at the State Emergency Operations Center. They come in and they ask for, hey, do you have a report about who's still without power? And we need to have that utility information and the utility company, your utility number, so that we can share that. Make sure your generator information is current complete. Make sure that we have the type of generator that you have, the type of generator, the type of fuel it uses, so that information is all right there. So if you say, hey, I need some help, I need some fuel, we can go right there and we can see exactly what it is you need. Again, confirm your plan evacuation locations are current and accurate. And document the source of transportation that will be used if there's a need to relocate your residents. So there have been a couple of updates and upgrades that we've done to the system, and we're going to continue to enhance HFRS. And I'll tell you, we're one of the few states in the nation that actually has an electronic system like this. And we use this when you are without power and you're on your generator. Yes, we're going to visit. Right, we're going to visit your facility, and I've set a standard that we're going to visit your facility until your power's back on. So those are some of the things that we do kind of globally with all of our residential providers. We visit hospitals too, so don't think it's just ALFs and nursing homes we visit. We visit hospitals as well. So want to make sure, if you haven't done this, if you have a new property, that you are doing this right now, that you're always looking at your plan. Matter of fact, I had a call this morning with my management team, and you know what we talked about? Training for HFRS. Training for our staff for HFRS. So it's always part of the conversations that we have with our management team. Emergency management planning, obviously, these are some snippets right out of the new Comprehensive Emergency Management Planning criteria that came out in 2023. All hazards approaches, so you always have to think about that. Now, you're not probably going to capture everything, but things like, in addition to hurricanes, we know we've had tornadoes. I mean, we've had a lot of tornadoes in Florida, I know. I mean, we've had a tornado hit a nursing home a year ago, knocked their roof, messed up their roof, and they had to evacuate. And it wasn't even hurricane season. Floods, all these floods, we've got a lot of flooding going on. And fires, we actually had a fire in a facility in the Alachua area just this week. Power outages due to weather. I mean, I get alerts all the time about big old power outage in Duval County. I mean, can you believe that? Duval, that's a big old county. Extreme heat and cold. As I mentioned, earlier this year, we had to deal with the cold factor in North Florida. And I know sometimes it gets, 75 down here in South Florida. Everybody thinks of freezing to death, right? Oh, you down here. But any of these, potential threats, and even cybersecurity. Think about cybersecurity. A lot of you raise your hands and say, hey, yeah, I do electronic health records. You're at risk. You're at risk from a cyber attack. So make sure you're protected and make sure your staff are trained so they just don't go around clicking on everything that they see. So be mindful of that. Things you have to include your staffing plan. Make sure you have a staffing plan that your staff know if they're on A team or B team, that they know who they are and that you've got yourself covered during the time of a disaster. Communication and notification plan. Make sure that you're communicating with us through HFRS. Make sure you're communicating with local county emergency management. Disasters are local no matter what type of disaster it is. So you need to maintain that local communication as well. Drills, make sure you're doing drills. The more drills you do, the better you are. Your staff will be prepared. They'll be ready to go. It takes a little while to evacuate a 120-bed, 150-bed assisted living facility, doesn't it? Especially if not all of your residents are able to just grab their bag and head out the door. You got to think about all the other ancillary stuff you got to get together as well. Emergency resources. We have a lot of emergency resources. Actually, we have a page for emergency preparedness on our website. A lot of great resources as well. Evacuation plan and reentry. Part of the ALF requirements say that if you evacuate, then the local county or designee has to approve your reentry, and the designee is us. So we would do it. And reason why is not to hold people up from getting back in their homes. We try to do it very quickly, but we want to make sure there's no damage, there's no, leaks, that things are safe, and we do get back out as quickly as we can to do those. So I want to make sure to share with you, some of the things that we continue to see as it relates to our healthcare industry with our providers. We have over 30 provider types that we regulate, and not all of them are required to update health facility reporting system. Only our hospitals and our residential providers, which ALFs are a residential provider, so you are required to report. You also know last year that, and Gail supported it, we also took the approach of if people aren't updating HFRS, we're going to start finding people, and we did. I mean, we had fines of over $200,000 between both hurricanes. And listen, they were hospitals, they were nursing homes, they were assisted living facilities, they were adult family care homes, they were our crisis stabilization units, our residential treatment facilities. Nobody was immune to it. Everybody got something. It wasn't a large number, but still enough that we hope people understand that how important it is to do that. Because if not, we have to take time to call, and you're in the middle of a disaster. You don't want us calling you. So that's why it's important to get that updated. So just wanted to kind of go over emergency preparedness and response. Again, I can't go anywhere in the country, actually, and not talk about emergency preparedness and response. What I want to move next to is data. Like I said, everybody asks us about data and inspections and outcome. And, we talked about our top 10 deficiencies and looking at that data. But as we look at just overall our data, I want to show you how you compare to other provider types. So as you see here, this is in 2023, our total number of inspections. So as you'll see to the left there, over 13,000 inspections in our healthcare facilities, excluding ALFs. ALFs, 4,000 of those, over 4,000. So if you see the total number of inspections that we do throughout the whole state all year in 2023. Now we broke it out for assisted living facilities, as you'll see here, the total number excluding ALFs, and then ALF complaints. You'll see the total number of ALF complaints, our ALF licensure surveys and resurveys, and then ALF monitoring. Now, a lot of people have said to me, well, what does monitoring mean? So we do generator monitoring visits. Any of you had a generator monitoring visit recently? Okay, yeah, so we're doing generator monitoring visits. We may do a monitoring visit if facility's on a fire watch, and sometimes that happens, and we'll go in and do a fire watch visit. If we've had a facility cited for a Class 1 deficiency, and that's if they're imminent threat to health and safety of residents, we will do a Class 1. We will do a monitoring visit. If we have a facility under a moratorium, and obviously emergency suspension order, where a moratorium you have to limit your admissions, emergency suspension, then we're telling you have to cease operation. Then we're doing monitoring visits during those time as well, and closure monitoring. So we do closure monitoring visits when a facility does close. So I wanted to kind of tell you a little bit about what that is. So that's calendar year 2023. So let's look at 2024. So in 2024, our total number of inspections crept up a little bit to over 15,000, whereas you'll see ALS 4,600. So about is what it was in 2023. And as you can see here on the right, that breakdown, whether it's your license renewals and or your complaint investigations, and then your monitoring visits. So we know if you look at the number of monitoring visits we did in 2024, we just talked about the reason why we probably had a lot in 2024, right? We had those 3 hurricanes that we were doing a lot of monitoring visits on. And then as we get to 2025, now this is the total number so far from January to June of 2026. As you'll see here, we're already at over close to 8,000, probably 8,000 by now, over 8,000, 9,000 for all of our facilities. And then on top of that, over 2,000 already. So we're about that kind of average. We should be getting into 4,000, 5,000 ALF inspections by the end of the year. And as you can see here, that breakdown of those between complaints, our license. And when I say licensure surveys, I would mean either an initial and or a renewal or a when you do a chow and you get that provisional, that would count into that same nodal as well. And then our ALF monitoring visit. So it's always interesting, for us to take a step back ourselves to look at some of this data. It's always amazing to me how many inspections we do annually. And when I showed this to some of our nursing home folks not too long ago, obviously theirs was broken out. And then when I talked to Leading Age Southeast earlier in the week, they were like, oh my gosh, because some people don't understand that we do more than nursing homes and ALFs and hospitals. Those are the big three. That's the ones you see in the news all the time, right? That's the ones you hear in the news all the time. But we have about 30 provider types that we regulate. So that total number encompasses all these provider types we regulate. So I wanted to show you that to say our teams do a lot out there, not just ALF focused. But one thing I want to share with you, as some of our severe deficiencies that we have, because we want you to prevent these. We don't want these to happen in our assisted living facilities in Florida. So these are some numbers for class 1s for calendar year in 23 and 24. In 23, we had a really high number of class 1 deficiencies. That dropped some in 24, and through June of this year, we're at 25 so far. 22 so far. I hope that doesn't go up, but I'm quite sure it is because we're in July, and I know we've had a couple of other facilities that have had class 1. So I wanted to give you a couple of examples of class 1s. One, I'm not going to talk about it again, but I mentioned it when I started about the air conditioner situation and how those residents were placed in that imminent danger, and how we had to go in and essentially micromanage their evacuation, but they placed residents at a high risk. So we did cite that at class 1, and so that was one example. Another recent example is elopement. A resident eloped and was unfortunately struck by a train. Yeah, that's horrible. This poor resident lost their life. They eloped, and what's interesting in our investigation, one, the facility had no idea that resident was gone, and the front door, the door had a broken lock on it, and facility was unaware that the front door lock was broke. So this resident was known to wander and known to have elopement tendencies. And we talked earlier about what we're citing in our top 10 deficiencies related to elopements, and staff training, right, what's required. And that's why it's very specific in the ALF requirements about the requirements for elopement, policy, procedure, and training, and giving that policy to your staff so they know what to do. So this resident, again, obviously that's a class 1. This person got out, staff should have known, and they didn't, and this person lost their life. We did have another ALF related to that got class 1. I'm going to put my glasses on to see this. That one of these situations in which, and this was down here in this area, unfortunately, where an ALF was newly licensed, had a change of ownership, so had a new owner, but they were one of these ALFs that wanted to provide like post-surgical care, trying to fit that into the ALF world. And unfortunately, they had a woman in her mid-40s that had a cosmetic surgery, went to this ALF post-surgery, had some very significant issues, was starting to deteriorate. And instead of calling 911, the current staff in the facility called the previous owner. Previous owner came to pick the resident up and said, well, I'm not taking him to the hospital. I'm going to go to the surgery center where they had surgery, and ended up the person coded in the car, and they had to call 911, and the person did subsequently die. So that was a class 1. It's just amazing what happens, and that's why you guys are out there all the time too. These are people who are down the road from you in your neighborhoods as well, around your facilities. We got to make sure people are educated to. So if they apply to us, they meet those minimum requirements. We have to give somebody a license. So then they go out and they're trying to do this above what they're licensed for. And these things happen. I think we found this out because it was in the news, right? Or it was in the news or the hospital reported it? I think it may have been the hospital, but we found out about it and investigated that situation. But yeah, so those were some examples of class 1s that we have. Obviously, we have class 1s related to elopement quite frequently, and the CPR situation, failure to initiate CPR. So that's something. And one other thing I want to show you as it relates to data, and then I have complaint data and then adverse incident data I want to share with you is, we do a lot of complaints. A lot of what we do in our world, in the regulatory world, in addition to our regular, you guys have to have a survey by us every 2 years. Nursing homes have to have one by us every 15.9 months. So they have more surveys. But a lot of what we do is complaint driven. So what I did want to show you here is the number of complaints we receive and investigate for all provider types. Remember I talked about there's 30-something provider types. And then the number of complaints that we receive and investigate for ALFs. So as you'll see here, the total number essentially that we investigated in 2023 is over 9,000. But in ALFs, we received about 3,200 and we investigated over 2,500 of those. As we move to 2024, you'll see that we investigated over 7,000 in all of our provider types. In ALFs, we received over 2,500 and investigated a little over 1,800 as well. And so far, up to July 9th, we received investigated over 2,700, and then in ALFs, over 1,500 received and investigated over 600. So I know people feel like that, oh my gosh, I get these complaints all the time. You're coming in with 4 and 5 and 6 complaints, but the number, based on the number of assisted living facilities, over 2,900, this is kind of a smaller number of as far as complaint investigations that we do. So that's complaint investigations. But I also wanted to show you that and show you this as we talk about adverse incident data. Now, I want to make sure everybody understands, and you see here from the numbers, that we do get a lot of incidents reported to us. Now, in ALFs, you're the only provider type right now that has to do a day 1 and a day 15. Nursing homes are only a day 15. But nursing homes have an immediate and 5-day on the federal side on top of the state side for 15. Hospitals and ambulatory surgery centers, in addition to HMOs, have the 15-day requirement. So as you'll see here, these are all the categories: death, brain and spinal, disfigurement, fracture, dislocation, no consent, transfer, law enforcement, and elopement. So these are the adverse incident categories that you would be reporting to us. And you can select multiple ones, as you know. And as you'll see here, so let's look on the right side there in 2024. The most reported to us, as you know, is transfer. So typically transfer and fracture dislocation, those are always in high numbers for us. Pretty consistent for the last several years as far as high numbers for us. And then you'll see total submitted was over 7,000. So individual reports were over 4,900. But even in 2024, we initiated over 508 complaint investigations based on adverse incident reported. So I wanted to kind of dispel a little bit of those rumors that, I'm nervous about reporting this to the agency because they're going to get in their car and come out and investigate us. I wanted to show you this to show, no, not every adverse incident reported to us do we investigate. That's why it's important that you make sure that you share the most accurate information you can with us, that you do a thorough investigation. If you have any questions, we can actually talk to you about the statute and the rule for adverse incidents in Chapter 429. We can't tell you to report or not report. You're the ones that has all the information at hand to make that decision. But it is important that you really do a thorough job and you report to us all the facts. And don't be vague. Never be vague in your reports to us. And if our teams in Tallahassee, our complaint risk management unit, they're reviewing your adverse incident and they have questions, they're going to email you. They're going to reach out and say, hey, I have a couple of questions. There's some gaps in what you submitted. I'm telling you, I encourage you to respond back to them and answer their questions. The more information you share with us, the least will probably come on site. But if there's gaps and what's sent to us, if it doesn't look like it's a thorough job, if it's investigation, if it's very vague, if we're not able to get any more information, odds are, if it falls into one of these categories, we are probably going to come on site and initiate a complaint investigation. So I just wanted to kind of show you that and talk you through a little bit about kind of how it works as adverse incident report. And as you can see here, up to June, so far, again, we're still got those high areas in transfer and fracture dislocation, and total some reports submitted, over 2,000, and investigated 261. So got a lot of other complaints we do, but that's kind of it in a nutshell for kind of adverse incidents. Yes, sir.
I just had a quick question. When does the withdrawal function come into play? Like, do you do a 15-day on every single day one that you put in?
No. So you do your day one, and you need to look at the definition in 429 and do your investigation and make that determination if it falls into one of these categories and meets the definition of adverse incident.
Okay, so then if it doesn't, that's when you do the withdrawal?
You can do the withdrawal, yeah. Yeah. But you got to go back to the definition. A lot of people don't. They just, so go back to the definition of what adverse incident, what you're required to do. And you can call us. Like I said, the team's not going to say, oh, you better report or not. They'll talk you through the statute.
Thank you.
Sure. All right, and lastly, I want to talk about a few reminders for licensure. Now, one, you were sent 2 notices prior to your license expiring. First of all, you have a license. Your license should be posted in your facility. All of you got your license posted in your facility? In a conspicuous location so people can see it. So we email that to you now. We used to mail it. You had a nice little hard copy. So you should print that out and post it. So you should know when your license expires, right? Absolutely. If you're a licensed practitioner, you know when your license expires, right? I can guarantee you, these nurses in here, you know when your license expires. Absolutely. So we provide 2 notices to you, an email and a postcard. We notify you 2 times about your license expiration. You would not believe the number of provider types, and I don't mean just ALFs, the number of providers that fail to renew. Now, everybody's license is on a 2-year cycle. So listen, what I told some other people, put it in your phone, in your calendar. Flip to if you got your license for 2025, you know it's going to expire in 2027, right? Go to your calendar for 2027 and write a big old mark so you know. Because the worst thing in the world is for your license to expire and you have not submitted your renewal application to us. Gail knows what that's like, don't you, Gail? Oh, my Lord. I thought Gail was going to track me down at my house one day. I know you do. I know. But we will work with you. But let me tell you what, that's a domino effect. So if you fail to renew, we send you a letter that says, well, you're no longer able to operate your ALF. You got to get people out. We're required to do that. By statute, we're required to do that. But we will work with you. We'll do a reinstatement. We'll work with you. But you got to move fast to get us your license renewal application, your fee in. Yeah, we're going to fine you a late fee. I'm going to get your money. Now, I can't do anything with it when I get it, but I'm going to get it. But we're going to get here. You have to pay us a late fee. And yeah, you're going to have that survey. And we're going to work fast. But when we're doing all that, all these other people over here that's done everything right, guess what we're having to do to them? Shuffle them and push them down. So you need to make sure you're paying attention to your license renewals, that you know when they're coming. If you're a company and you have 10 properties in Florida, I'm sure you got 1 or 2 people that manages that for you, right? Make sure if you have a change in those people, whoever's coming in behind them knows what they're supposed to be monitoring so that doesn't happen. So I actually have a couple of nursing homes right now that I literally had to text last night and say, my staff still say we don't have your renewal application. Their license expires July 31st. But that's next Wednesday. So they have to get that in. If not, they'll get the same letter that everybody else gets. But we don't want to do that. It's not what we want to do. We're not in the business of putting people out of business. We just have to hold you accountable for the requirements, and that is that you renew. So one of the things that has happened in the last 2 years is that mandatory online renewals. So mandatory online renewals. So we have our online licensing system. And this was to help to streamline the process, get payments in quicker, us to validate that the payment went through, you to get your information into us, and there's, pre-populated fields. So effective, and this is about over a year ago, so effective March of 2024, we had an updated rule that requires all providers, now it doesn't say AOLAFs only, it says all providers. So all of our licensed providers must submit license renewal application forms and fees and supporting documentations electronically through our online licensing system. We spend a lot of money, a lot of time developing this online licensing system. So in the rule, it gave a period of time to allow providers to get used to this and come into compliance. So a year ago, September the 5th, everybody was required to start submitting their renewal applications to us online. So your renewal applications must be submitted. Renewal applications submitted by mail will not be accepted. So you have to submit your applications online. If we get it by mail, then our rule says we can return it. So again, renewals are required to be filed by a specific deadline and must be submitted through our online licensor system. So we want everybody to follow this because if we have a few providers that go outside of that, then it just slows everybody down that may be in line behind them. So the quicker and easier it is, file everything online to us. I know sometimes there's some hiccups along the way with our system. Reach out. We definitely will work very quickly to get those fixed to move things along. But I did want to remind you of that. And again, we have providers. I have a lot of provider types that fail to renew or they change administrators and that administrator may forget. But we send two notices out, a postcard, and that postcard is going to go to your facility, and then we send it out through an email system. So just wanted to remind you of that. It's very, very important. And our licensure unit said, if you're going out to talk to providers, please mention this. So I wanted to share that with you. Now I will say, and I know Arlene and Marianne are here, but if you don't know your field office manager in your area, please make sure you reach out to them. It's important to have a conversation with your field office manager, and maybe you may be new to Florida, you may be new to, maybe you've changed companies, maybe you used to work in hospitals and now you're running ALS, maybe there's something different. Reach out to our field office managers and go in and say hello, who you are, put names with faces, hey, you have these facilities in your area, to maintain that ongoing communication and dialogue. It's always best to have these conversations, as we say, in blue sky versus gray sky, right? You want to make sure that you have them in blue sky. You don't want to wait till something horrible happens and then you got to call us or we show up. So make sure that you reach out and have that conversation. I know all around the state, I enjoy meeting with providers. I enjoy meeting and talking to our providers, finding out kind of what's going on, things you're having issues with. It's amazing. I met with a group, various groups of facilities last week, and just what you hear about, well, the hospital requires us to do that. Oh, well, the nursing home won't take this person back because of. It's very interesting to kind of hear that out there, and we just all need to work together. So part of that is maintaining this communication and conversations with our field office managers. A lot of you know me, you know my contact information, but here it is if not. And in closing, I just want to say, thank you. Thank you for what you do every day, day in and day out. And I know, we always are like the bearer of bad news sometimes, right? But I will say, we really want providers to be in compliance. And that's why I do things like this. Arlene and Marianne also provide educational opportunities to talk to providers, to share regulatory updates, what's from a legislative perspective, what happened. our top deficiencies so people are educated. We can't do it all. I mean, obviously there's onus on the provider to make sure they're in compliance with regs. But that's some of the fun things that we like to do is go out and educate and meet with our providers as well. But, again, thank you for what you do day in and day out. And we're in a world, I want to talk just a minute before I close about transparency. We have a new Secretary Siobhan Harris. A lot of you may know her. She was Secretary of Department of Children and Families for 4 years. Before that, though, she was at AHCA, and I worked with her when she was in Medicaid. She was our acting secretary for a period of time at the end of 2020 into 2021, and then left during that time. For 4 years, she's been the DCF secretary. Then March 10th, she came back to our agency. So she's really challenging us at the agency to really push the needle forward with improving quality in the state. And how can we improve, quality? And I believe that's definitely having conversations that we had today with your board and understanding what's going on out there, ways we can work together to improve the requirements, the regulations in assisted living facilities. But it takes all of us. It's not just us. And another thing that we're doing is really pushing a lot of information out from a transparency perspective. We've always been transparent in our agency. We have a lot of transparency websites. And I encourage you, if you're on our website, and I know I gave you some metrics earlier about the total number of assisted living facilities and then the total number that report that they provide memory care services, that's not some secret data I got. That's on our website. So we're very transparent. There are ALF comparison tools on our website that somebody can go in and they can look and see, hey, well, I want to compare this ALF to that ALF in Broward County. So we have those comparisons out there too. We have consumer information about selecting an assisted living facility. So if I'm a family member and I need to put my loved one in an assisted living facility, what do I need to know as a consumer? So we're really enhancing that information that we have out there. And I want to ask you as ALF owners and operators, take a look at our website. If you see something that's not there that you think maybe this would be great to have that, from a transparency standpoint, to maybe educate other providers or maybe educate consumers. I got a lot of great information from the Home Health Agency Association that I spoke with earlier this week. They're like, oh, we need to fine tune this. Absolutely. Send it to me. We really want to enhance this. Again, that's one of our secretary's initiatives. She's really pushing us to get some more information about behavioral health services. Some of you may or may not have limited mental health in your assisted living facilities, but that's something that we're looking at too. Better education about what resources from a behavioral health standpoint are out there for our consumers. When you have a family member and you're dealing with a crisis, what can I do? What are some services out there? So those are some things that I wanted to share with you, but also just to thank you for what you do day in and day out. I know I've spoken to you a lot of times over the years during a hurricane or something or some crazy event that's happened. Feel free to, continue that communication with us. It takes all of us. Over 1,000 people move to this great state every year. Every day. And they're on 75, and I'm about to get on the turnpike and eventually hit 75. They're probably on the road with me, not knowing where they're going, not knowing how to drive. But anyway, they're coming to Florida. And so we are a state that always is out front. And we want to continue to be out front. We want people to say, hey, I'm moving to Florida. I want to move my mom or dad here. And I want to make sure I move in an area where there's going to be great health care. And you're part of that health care continuum. It's not about always hospitals. It's about these facilities that you guys own and operate and run in our great state, to making sure that you are providing that care and services. Just continue with that continuum of care and services in our healthcare system. I'm proud of what we do. I'm proud of being in Florida. I'm proud to speak about it nationwide because we do a fabulous job. We have issues. We work together, and that's what I like, is that we work together to improve and enhance what we do, and we come out better for it, and our quality improves because of that. So thank you for what you do. Thank you for allowing me to be here today. I appreciate it. Thank you for having Jim Brown, our Legislative Affairs Director, all week with you. But thank you all, and thank you, Gail. I'm going to turn it over to you.